Hi, my name is Tira Gunlock, and I'm the Vice President of Client Care at First Stop Health. There is a lot of well-founded anxiety regarding the coronavirus, but there's also a reason to be hopeful. During this pandemic, as opposed to 1918 or 1957, we have resources that allow us to stay healthy and get better without leaving our homes. One of those resources, of course, is telemedicine. Today, I'll answer 7 of the most frequently asked questions we're getting from our clients and hopefully ease some of that stress you may be experiencing. The first question is, how can I stay updated? Our COVID-19 Resource Center, available on our website, answers some of the most common questions we get from patients. We continue to update our blog on what employers need to know about coronavirus as well. The second question is, what happens during a telemedicine visit? During a First Stop Health telemedicine visit, a patient's symptoms are evaluated to determine if they are consistent with COVID-19. If they are instructed on what they should do if they may have it, such as to isolate or quarantine. Our doctors cannot order COVID-19 tests. Patients must work with their local public health authorities to be tested, and testing remains in short supply and is typically limited to those that have the highest risk. Number 3, how does First Stop Health follow up with patients? We always try to ensure a patient feels cared for even after they speak with the doctor. When a doctor determines a patient has COVID-19 symptoms, a follow-up message will generally instruct patients on what to do, link to detailed patient instructions for follow-up, provide helpful resources, and link to a sick or excuse note if appropriate. We have to protect patient privacy, so we cannot disclose to a client if, for example, Jane Smith is recommended to isolate. That said, through messaging, we do encourage individuals to be open with their employers about this virus. Number 4, does First Stop Health provide excuse notes? Yes. The CDC actually recommends that during this pandemic, employers not require a doctor's note because doctors' offices may be unusually busy, and this might put an additional burden on employees when they need rest. But we know that this is practically difficult for some of our clients. To accommodate their need to continue to require documentation, we continue to offer excuse notes to our patients. They are available on the mobile app and web applications. Temporarily, we have extended the maximum length of these notes to up to 14 days to accommodate quarantine recommendations. Ultimately, we know that every employer has different guidelines, and it's up to them to decide if these notes are necessary and/or sufficient. Number 5, does First Stop Health provide return to work information? Yes to that as well. And this is one area in which we've streamlined service for members recently. To be clear, because our doctors cannot test for COVID-19, we cannot certify that a patient does not have the virus. We have, however, provided an easy questionnaire for patients to answer on what they have or have not done with regards to the virus. The link to the questionnaire can be found on our login page. After a patient completes the return to work questionnaire, responses are reviewed by our clinical team, and then a document is emailed to the patient with the appropriate information. Returning to work is considered safe following upper respiratory symptoms when you have not had a positive COVID-19 test, have not been recommended quarantine or isolation by a First Stop Health doctor, or have completed recommended quarantine or isolation, and have had symptoms start more than a week ago and have been symptom-free for 72 hours. Remember to check with your local health department for guidance on if employees should take additional precautions when returning to work. Number 6, is utilization increasing? Now, as you would likely imagine, we have seen an increase in patient visits and in client utilization. The first person that called in reporting coronavirus as a concern was on March 9th. Generally, clients have seen an increase in utilization as a result, but that varies from client to client. Over the last week, 17% of the visits were from people specifically calling in about COVID-19 issues. The larger increase we've seen is on all of our other typical symptoms and issues we treat, such as allergies. It seems that people are heeding the advice of experts to stay home if at all possible, so telemedicine is the right option when you're trying to avoid waiting rooms where sick people gather. We've seen a few spikes in our average response time to doctors here and there, but still have outstanding results in terms of average wait times. We set expectations individually with patients that it may take 30 minutes or an hour, so when we call them back in 10 minutes, it's a wow experience. And number 7, how can we promote First Stop Health telemedicine? Our mobile app is the easiest way for patients to request a visit with a doctor. With now more than 80% of Americans having a smartphone, we will continue to promote the app with all of our members. We also regularly communicate with them via email and provide flyers as well. If you need additional promotional materials internally or have questions about COVID-19, please reach out to your account manager. My contact information is also listed here, and ultimately, we are all here to help. Thanks for listening. Be safe and be well.